Hi folks, Canadian Prepper here, back again with my main man, the survival doctor. We are going to show you some life-saving medical tips today, so make sure you stick around. This is information you need to know before the crap hits the fan. We got to get to the lab. What do you say, buddy?
Let's do it.
Let's do it.
When you first get a wound, especially if it's a deep wound, is it a major bleed? Is make sure that that bleeding stops, because you don't want to lose any of that good juice. Put on a tourniquet on and continue running as far as you can take yourself. The level of infection and potentially tetanus is really based on that first initial load of bacteria.
On my journey, I've cleaned my wound, got all bandaged up with my duct tape, headed through the farmer's field. I'm in the clear now from the blast zone, and I'm on my way to the forest. And suddenly I noticed that there's some marauders, pursuing me. Looks like it's gonna get nasty. So we get into a good old-fashioned gunfight, okay? I came out the victor, but I still got shot. Let's say I got shot in the arm or something like that. Gunshots. What do we do about gunshots? You've obviously done 6 years in the military. You've probably seen gunshots in the ER. Let's just say, for the sake of our example, let's start with an arm. Let's say I get shot in the arm. How do I deal with that situation?
So at the get-go, I want to define it as like, hey, if this is a massive bleed, completely different than if this is a minor wound. And it really depends on how it's bleeding and the caliber of the shot. Because if you get shot with like a 50 cal and you have an amputation, that's going to be completely different than if you get shot with like a 5.56. So if it's a 5.56 and you're bleeding a lot with direct pressure, my first bet would probably be to go with a tourniquet, especially if you are not sure how many shooters there are. Like you got like maybe one or two, but is there a third there? Are you counting your shots when they're coming towards you? And looking at the different arcs of fire and directions. So if you are bleeding massively and it's from an extremity, whether it's legs or arms, I would put on a tourniquet. And the second situation that you need to be aware of, is it active fire? Or are you completely, there's no return of fire, everything's neutralized? Do you have time to see where that wound is? As early of like just last month, I've seen medical preparedness people talking about tourniquets and tourniquet myths, and still perpetuating some of the falsities of some of these myths. So it's really important that we are clear that you can put tourniquets below the elbow and below the knee. And one of the things in the past was, hey, it's more effective to put a tourniquet because on a long bone, because you're just compressing that vessel onto a bone. But you can't do it on the forearm because there's two bones. That's completely false. Because what you're really doing is you're compressing your muscle tissue and whatever tissue is in that extremity onto that blood vessel, onto that bone. And in addition to that, because it's a lower diameter or a smaller diameter, there's less to compress. Like if you just think as simple as blocking a pulse on your kid who has like a much smaller diameter arm versus your own thigh. Sure. Like what's going to stop the bleed faster? Something that's closer to the wound. So if you can, and it's a safe situation, I would expose that wound with my trauma shears and then place that tourniquet 2 to 3 inches above that wound. So 3 or 4 fingers above that.
Okay, in a gunfight, got the rucksack on, got shot in the arm, took care of my adversaries. So what do I do here? I'm bleeding out.
So bleeding out and you're all alone, first thing I would do, if there's any way to put pressure on it like immediately, whether it's through your hand, but if you are alone, that's why you need to have your trauma first aid kit as close and as readily accessible to you as possible. It's not the bottom of your rock type of deal. It has to be like really accessible. So when I was in the military,
most people wear their tourniquets on their shoulder.
They wear it on their shoulders. They kind of wear it on there. There's some pants that have active ones that are already there.
Now just anatomically before we proceed, depending where I get shot on here is gonna make a big difference. Like if I get shot right over this vein, that's a big deal versus over here. When people get shot, I'm assuming there's like a fracture of the skeletal as well.
Yeah, so bones bleed as well. Your job right now is to kind of compress as much tissue as possible, so that limits the amount of bleeding. So you have your veins over here, but also your radial artery. So that's a big deal as well.
So let's just assume that this is a very aggressive bleed. And
Very
we need
aggressive
to stop
bleed,
it.
and you want to stop it because basically you're getting a little bit woozy because you're losing so much blood. Definitely recommend everyone prepping their tourniquets. So I don't want anyone who buys a tourniquet and it's still in the plastic wrapper in the bottom of your pack. It should be one of the first things that you reach for. And what I like doing is priming it so that I have this little loop here and just thumb in and it's ready to go.
This is a SAM tourniquet?
This is a SAM XT. So it's already ready to go. You just place it over here.
Yep.
And since I'm the kind of person doing this, I'm having this tail towards me because it'd be awkward to kind of go over yourself like
Right.
that. But if it's on yourself, you want that on the inside of your body.
So I'd be flipping this the other way then.
Flipping it the other way.
Yep.
And with the SAM, what I like is it has an audible click.
Okay.
And then after that,
So it knows when it's enough tension?
yeah, because the most common issues with tourniquets, whatever model you use, is that initial pull. If it's like just, it's there seated, sometimes even if you're turning it, it's not tight enough and you're just turning and it's not tight enough. So that first pull.
So what do you mean by
real.
turning for people who don't know what you're talking about?
So this is, they call it a windlass. It's kind of a device that allows the band to get tighter. So we'll turn it once, but typically 3-4 times until the bleeding stops. And again, we're about 3 fingers away from that site and the pulse stops. If you do not stop the pulse, turns this into a one-way balloon. So blood through the arteries are able to push out, but you're blocking blood flow from the veins, and that just accumulates and accumulates. As the pressure gets more and more prominent in this arm, it kills off more tissue. So that's when it becomes a huge issue.
to get nerve damage and stuff
You
like
get
that.
nerve damage, you get muscle damage, you lose function afterwards. So let's say we stop the bleed, it's day 2, and you can't use your hands anymore because you did that. And not only that, like I have to come in with a knife and open up your forearm and release some of that pressure. But you stop the pulse, you kind of put the tail here, secure it over here, and then the time. So you write the time there. You can put a tourniquet on that guy's head and write the time too. But it's important because you don't want this on forever. That's kind of like the stage 2 of what I teach people, especially in preparedness type of settings, is you don't want this on for hours and hours and hours. What you do want is to have a plan within 2 hours. So whether that's, hey, calling your rescue team, or if you are just there with your fire team partners, what are you gonna do after that? Conversions from tourniquets to pressure dressings or hemostatic agents kind of is the level 2 of learning this, because oftentimes people just teach you how to put on a tourniquet and that's the end of your lesson.
So this is what you would go into in your more advanced courses that you offer at Survival Doctors.
Actually, like with the free kind of trial, it's 30 days of lessons. We're going through our tactical combat casualty care training right now. By the time that you see this, that's probably going to be all available for you, and you can just try it out for free. You'll get live lessons with me online, and you'll learn all this stuff at a very high level. So a lot of the things that are trained to the troops, you'd get even beyond that, because when I was going through that training, I was like, what about this? What about this? What about this?
Just basic. The reason why they call it basic training.
Yeah,
right?
exactly.
So you were saying that there was a debate as to whether or not you should go below the elbow. So in this situation, some people would go up here.
I would say the only situation that I would recommend going like higher is if you were under fire, if that environment was dangerous and you didn't know how many bullet holes you had, you just know that you were bleeding there. That situation, I'd go high and tight, do it, and then get out of there. But as soon as you can, you want it closer to the wound, especially in thigh injuries, because again, that's a whole lot of muscle tissue. And what that means is it's more hard to compress that blood vessel because you're going through multiple different layers to get to that blood vessel to push it against the bone.
Yeah.
And number 2, let's say you got multiple injuries. Like it is a firefight. You're not just gonna get shot once in the arm, maybe if you're lucky. But if you're bleeding from anywhere else, if it was like an IED that went out and you have some internal bleeding, that big muscle, your thigh muscle, is more susceptible to shrinkage too. So if you're bleeding from somewhere else and that muscle shrinks, tourniquet's gonna be loose. So within like 5 minutes and that tourniquet's loose and you thought Buddy was okay, he slowly bleeds into oblivion and you didn't know because you stopped the bleed, you stopped the pulse, but they had some other bleed and that thigh just kind of shrunk and it becomes loose.
What about things like this, like clotting agents? When would we use like this is a clotting sponge, and then we have some chitosam, which is non-sterile now. This is like, what is this, shellfish or something?
So chitosam is from shellfish, specifically shrimp. I believe it's a polysaccharide element of that shellfish, so it's kind of like a sugary, starchy based thing. The two kind of recommended agents for stopping the bleed via hemostatic agents is kind of like the quick clot genre. There's also Celox, and then also Chitosam as well. Celox and Chitosam are pretty similar. So just opening that, it's this impregnated stuff over here. And this one looks like this goes over a wound, but really what you want is things that are impregnated like this if you're packing wounds. Because just putting this on top might coagulate the stuff for minor wounds, but you really want it as close as possible to the wound. So let's say if it's something like this and you're trying to stop that bleed, you really want to pack this in here.
In the wound.
In the wound as much as possible. That's the first thing.
You want to open it a bit and then pack it in there.
How you would do it is, let's say you're doing this and it's a massive bleed, and typically for wound packing, you're doing junctions. So if it's in the neck, if it's in the armpit, if it's in the groin, you can't put a tourniquet there. So your first bet is to pack it. So with gloved hands, I don't have gloves on me over here, but there's kind of two techniques. You're either rolling it like this and pushing it, but what you can do in this type of injury, let's say you have a gloved hand and it's just oozing, or even worse, pulsatile, it's squirting. What you can do is immediately go in with your finger, feel where that pulse is, and press. Because at the very least, you're clogging that direct bleed. And with your other hand, you're basically balling this up and pushing it into that wound, to that area that you may have felt a fast flowing bleed or a pulse, and you're keeping it there.
Is that something you need to learn, or is anybody going to be able to kind of figure that out? Or is that something like acquired?
So it's definitely something that you should practice, because with gloves it's a little tricky. But one of the biggest mistakes that I see or challenges that I see with some people doing it, or with my students, is the dexterity for it, because you want pressure on that area at all times. So that means either it's pressure here and you're pushing down and exchanging and replacing that pressure, or you're kind of doing this and changing fingers. So if you're changing fingers, then that requires a little bit of dexterity.
And all the while there's blood just gushing
out, and you're just trying to shove this in as fast as possible.
Right.
And once you shove it, and it is hard as rock, there's literally no way to put more in. You're putting this on top, and then you can use your Israeli bandage, then you can do all that. And so another tip that I have for you guys is, before you bust it,
all right.
It's okay, it comes in double packages, but let's say you're trying to make sure that the moment you need any kind of emergency bandages, it's super quick. You can have pins like this. So these are basically for like diapers or whatever. And I would pin one part into the bandage itself and one to your first aid kit. So as you're bringing it out, it just rips it open for you. So that increases or decreases the time.
Wouldn't that make it not sterile then?
No, because for Israeli bandages, and a lot of these bandages, they come in a secondary packaging like this.
Okay, so
if you just attach it to this, that's out, and then you can work on this instead of going through two different packages.
Okay. Yeah. So you were going to show me that before I tore into it.
Yeah. I like Israeli bandages for a few different reasons. One, they are pretty compact. Like, look at this kind of footprint. You can put that in your first aid kit. You can even keep it in a fanny pack.
Yeah.
And number two is it's a fairly long bandage. You get a lot of material out of it. And number three is that specifically, let's say that is your injury.
Yeah.
These are excellent for upper extremity injuries because they have this little loop over here. So that little loop, you can, especially if you're doing this on yourself, and why the Israeli army likes this so much, and a lot of soldiers like it so much, you can literally put it on that extremity, put this fluffy part, gauze, on top of the wound, and every pressure dressing that either you buy commercially or improvise has some kind of mechanism to add pressure. Now this one, it's kind of like this smiley face, and how it works is you go in the middle and torque it the other way. And you see this plastic edge over here, you can see the top edge over here. That goes directly on top of your wound. And as you are wrapping on top of it, that edge just digs into that wound and adds pressure. One thing that I like about some of the newer models, you can see it over here, it has these little tabs. And these little tabs, because when you're jittery, when you're literally got shot,
yeah,
the most common thing is to drop this. or to like mishandle it. And this allows you to save that kind of roll, so you're not fumbling.
Yeah.
So I really love that.
But
and
it's
then,
easy to peel through if you need to.
And one thing that I would highly recommend is as you're doing pressure dressing specifically, you're twisting so that it becomes more of like a rope-like device right over that pressure point, because it adds more pressure to that area. So you're just twisting, and going over. So you can see how much bandage this actually is, because I'm still going and going and going.
Yeah.
But one of the things that can be tricky when you're doing it on yourself, when there's a bloody scene and everything's getting really slippery, is I'll show you a little trick that I have at the get-go, which will help with some of the slippage. Because let's say you're just jacked like you are and you can't get it up to your biceps.
Thanks. Okay, so you put that part there over the wound itself.
Yep, so that can go over the wound, and then this goes directly on top of it as well.
This is after the wound is packed. So ideally you'd have your Kaito-san, then your Israeli bandage on top of it.
Yeah, so let's say it's you and I can't put this in here, or this is broken or whatnot. This goes directly, you see that smiley face, on top of the wound.
Yep.
And to secure it in place, what I would do is I'd go on one side, and you're basically making a figure 8. And then after that, you go through the smiley, torque it backwards. And we can show you how tight it can be, and just see how your veins just pop out of your wrist just by doing this properly. And at the end of it, it comes in just this little clip over here that clips to the bottom and top of your bandage. So over here and through over here.
Very practical.
Yeah, so if you can see, like, that's definitely stopping a lot of blood flow, but mostly venous blood flow, because if I go over here, I can still feel your pulse, and that's the big
Venous blood flow.
So that's veins.
Okay. Veins are efferent or afferent? What's the terminology?
So veins, they bring blood back to your heart.
Right.
Arteries push it to your extremities. So for pressure dressings, you're stopping the venous blood flow, but not the arterial. So that's the big difference. So that's the Israeli, one of my favorites. And the other one,
I think my hand's gonna fall off.
Yeah, I'll take that off of you. Try doing this on your right side, so you're doing it with your left. You know, it does take a lot of practice. One thing that I teach in my lessons is neck wounds, because doing that and potentially packing your own neck and then doing a specific pressure dressing on your neck, that requires a lot of dexterity, especially when you're bleeding from your neck. You're gonna get dizzy, lightheaded, possibly a little nauseated.
This is something that's totally worth getting one, because these aren't that expensive. I think they're, how much do we sell these for? Like 14 bucks or something? Something like that. Yeah, so, you know, it's worth getting some of this stuff just to play with.
For practice, definitely just rolled gauze is super helpful. If you don't have a simulator like this True Clot simulator, what you can use is just your yoga block. You know, those are really dirt cheap to get.
This is a True Clot simulator.
Yeah, so this is the simulators that I use for my students.
And that looks gnarly.
Yeah, if you feel inside of it, it's almost like a huge cavitation. So when we're thinking about like...
It reminds me of something. Oh, okay. I had to throw in one. So closing wounds, super glue. Does it work? Everyone's like, hey, the military made it. That's what they made it for. Let me just, you know, I get a wound, just start pouring super glue on it. Would you advise?
I would not advise that, especially if it's any wound that's deep. If it's anything like this, you don't want to be pouring super glue into that for a few different reasons. One, if it's a deep and long wound, it is toxic to your cells. So it would prevent healing quickly. So if it's going to prevent healing, not the best. And if it also irritates your cells, that could lead to more inflammation of the area, and also higher infection rates as well. Super glues, I would like to advise, like, if you are doing that for very minor cuts, think about just a little bit deeper than a paper cut. That situation works best. And if you are thinking of making it heal a little bit better with that type of agent, go for the medical grade ones, because it's less toxic to your cells.
Medical grade. Where do you get medical grade super glue?
So it's called surgical glue, and I'm sure there's suppliers for that.
Okay, so we got some other things here. We have a braided suture. This is a polyester braid. You were saying there's also disposable. You can talk about that. We have a skin stapler, And I don't know what the hell this is. This is new skin. I bought it because it seemed like a good idea at the time, and the expiration date is, this is how long I've been prepping. You ready? Drum roll, please. August 2013.
Whoa.
Holy shit, time flies.
So pretty expired, but maybe it still works. Almost like a nail polish.
Maybe that's the surgical super glue you're talking about.
Maybe. When we think about wound closure, before you even think about it, clean your wound properly. Like I said, 100 milliliters per 1 centimeter of wound, and you can go more than that, it won't hurt it. Number two, your wound doesn't necessarily need to be stitched up all the time. If it's kind of approximated close together, that does increase your ability to heal quickly. And you can as simply do that with duct tape, you know? With a suture, especially if you don't have commercial grade ones, you're introducing a non-sterile thing into a wound multiple different times. You know, if you're using your sewing kit, you have to sterilize your whole thread plus your needle, and like I would probably use boiling water and then do that. And typically the needles that you use in those kits are pretty thick. So you're gonna be introducing new trauma. Mm-hmm. And especially if you're not doing a running stitch, you're kind of, it's a lot of time as well.
Yeah.
So
there is a suture kit that I ordered on Amazon. It's like a practice kit. Mm-hmm. I don't know, are those any good?
Those are excellent for learning the skills on how to suture. Mm-hmm. Because if you're in the situation where you're the medic of the group and you're in a base camp, you have the abilities to clean that wound and close it up so it heals faster and there's a reduced risk of infection. That would be the circumstance where I would recommend stitching yourself up, not after a firefight or anything like that.
Right.
Because the worst case scenario, if you clean it well, if you do proper wound care, you're just gonna have a big old scar. And what happens in, let's say, a gaping wound like this, the tissue slowly kind of fills up this area and kind of mounds it, and then it bridges the gap between the two edges of that cut. Mm-hmm. So that just gives you a scar. So our suture is 100% necessary in an outdoor setting, not necessarily.
Yeah, because you don't want to trap in bad stuff either,
Mm-hmm.
right? Like you're saying.
Yeah.
We also have a skin stapler. So at what situation will we use something like this?
So your scalp bleeds really, really quickly. So it's almost like if you put like this gauze on top of it and putting pressure, it'll get soaked within a minute, no problem. What you would want to do in that situation, since it is a cut, you can't put super glue on it. You can pack it, but you can also close it as well. And because there's a bunch of hair typically, it's hard to do stitches there. These staples are super quick. You can go directly on the skin. What I would typically do is I would pull traction, or if I have kind of forceps, kind of like little tweezer looking things, I'd basically put it over here, pull tractions, and click, 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 click. So you're basically lining it up and clicking like that, and it just does that. So it's basically—
And does it stick out? It sticks out like that.
So it typically goes like pretty flush to the skin. Let's see if I can do another one. So you're pushing in, and that's a little more flush to it.
And it doesn't hurt as much as you think.
No, it's a little pinch.
I've demonstrated it on myself before. I won't do it today, but it pinches, but it's not as bad as you think.
Let's say it's a big wound and you're in a surgery suite, you open it like that, you give it to your surgeon like that, so you're not touching any of that sterile packaging.
I mean, if you're in a gunfight and you're bleeding out, I mean...
I would never use this in a gunfight.
No, but I mean, like I was gonna say about, gloves and hygiene, you're just trying to get that thing. You don't care about prioritizing.
Exactly. Thing that can kill you in a matter of minutes versus infection that might come about in like a few days.
Yeah.
So this comes in a small little package like this, and you want kind of like a nylon mix of the strand. Absorbable, I would not recommend, just because...
Absorbable? What does that mean?
So on the package, it should say right there, non-absorbable, and some of them say absorbable. Mm-hmm. If you do an absorbable one, my concern is that it pops. So it's meant to dissolve over time.
All right, so you don't have to take it out, going to the doctor and get it pulled out.
Exactly. So if you're doing a non-absorbable one, you're typically going to have almost like a security that it's going to last there, especially if it's over a joint or something that's moving about. I want something that's non-absorbable. Mm-hmm. This is kind of like the suture, and looking at the tip, if you can zoom in really close to that tip, it's almost like a knife. So there's two types of tips. Typically, one of them are just like a point, and the other ones are a cutting edge. Sometimes the cutting edge ones are a little too aggressive for some of the finer stuff. It just rips through the skin, especially old people. So you might want to go for one that's just a point.
Is there a name for that?
So if you look on the suture package, it will tell you the size, but it'll also have a little diagram. Over here, it's like an upside down triangle. The non-cutting edge one, it will just look like a dot.
So this kind of has a bit of a blade on it.
Yeah, it has a blade on it, and you can even use that blade to like cut the rope too.
Now, is it painful to suture oneself? I presume it's not pleasant.
It does sting a decent amount. So ideally, you would have something to numb up the area. There are topical agents like lidocaine, and another one's called EMLA, and those are just topical agents. I typically use it for kids because like needles and then suturing is it's a big deal.
Yeah.
So you put that on for 20-30 minutes and it gets all numbed up, have them watch TV, and then you can go at it.
So lidocaine needs to be injected.
So there's
and how can the average person get lidocaine, or is it hard to come by if you're...
It depends on your distributor. So if you have one, they probably would need you to have some kind of training to
Level 2, I think it's classed as a level 2 medical supply. People can buy a lot of this stuff, but yeah, to distribute it, you need a license. So yeah, I guess it depends on your distributor.
And one thing that may be accessible is oral gel, because a lot of people use it for toothaches and that type of thing.
Benzocaine?
Yeah, so things ends in cane. It's the same kind of numbing drug class.
Right.
So if you can put some of that in the wound and numb that up.
Not cocaine.
Not cocaine. Okay. Different type of fun.
So benzocaine, you know, if that's all you got, that's all you got. You can put benzocaine in there. That will actually, or around it.
It should numb it up at least a little bit.
Okay.
If I had the freezing thing and you had a toothache, if you have the medical training, like I would actually do a nerve block inside your mouth, and that would just numb up the nerve for like several hours. So everything in your jaw, you wouldn't be able to feel.
Yeah. Yeah, I mean, those local anesthetics are something we take for granted, you know, because even just any anesthetic, I mean, painkillers in general, I'm thinking of, you know, back in the Civil War when you had to amputate a guy's leg when there was no, you know, just a bit of whiskey or whatever. Yeah. Is there any truth to that? Alcohol, like, as like a...
I mean, if you get drunk and you're not really conscious.
All right, so anything else to do with these sutures that we should know? I mean, is this something you teach?
Yes, that's something that our students learn in their third kind of milestone. So we start with life-threatening injuries, then we move into subacute injuries, then we learn long-term stuff. And these I would categorize as like a long-term medical skill.
This is like a fishing line almost.
Yeah, almost like a braided fishing line. So it is strong, it is strong.
If you don't have suture wire, what can you use?
So suture wire, you can use like monofilament line for like fishing. You can use like thread as well. But again, when you're using these things, you're looking, like take a look at your sewing needle eyelets. So those are little holes, they're quite wide. So compare that to something like this, which kind of tapers out and thins out at the base of it.
Yeah. You're
kind of putting a needle in and then widening it each time you're putting it in. So it is more painful if you do like an improvised needle. So this is basically molded. So if it's a string like that, the metal is molded on top of it and just like sticks on.
And it thins out, so it's actually less painful
less
as it goes
less
on.
Painful. Cool. If you are the type of person that are prepping and have their own like medical suite on their property, get sutures. Don't necessarily do it through sewing needles and that type of thing. Instead of going into the skin, you're going into the paracord. So this is a one-way valve where you can put that on. Air is able to be released this way, but no air is able to come back in. And you're basically putting it up here. All you need to do is you're wrapping and wrapping and wrapping so that it stays in place.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.